Hey guys, welcome back to my YouTube channel. Today we're going to be talking about common basketball injuries. See it this time of year. We're in the full swing of basketball season. Number one, ankle sprains. Probably the most common thing that I see. There's three main ligaments on the outside of the ankle. So people fall, they land on someone's foot, they come down from a rebound, and the ankle kind of gaps open this way. These three ligaments on the side, most commonly injured. What happens is it's a spectrum of injury, whether the ligaments just get stretched, which is a sprain, partially torn, or complete tear. If it's the first time you injure yourself, it really doesn't matter. It doesn't matter if it's completely torn or not. We try to treat it the same way, which is conservatively. That means immobilization with, I like putting people in a boot initially, starting some good physical therapy, and managing some of that swelling and bruising. The bruising can be pretty impressive. It can kind of go all throughout the bottom of your foot. All that's normal. There's also the rare situation that when you sprain your ankle, you can kind of see it gaps open. There's a bone in here called the talus. There's cartilage on that bone. It is rare, but you can injure that cartilage. And so if we are going through the treatment plan, we're getting you into good therapy, but weeks, months go by, you're still having pain, swelling, locking, those symptoms, that's the time that we talk about getting an MRI. A lot of people come in asking for an MRI right up front. For me, MRIs, we try to limit costs, and if it's not going to change our treatment plan, a lot of times there's no need to do that, no need to get the MRI up front. But if you're not getting better, that's when we talk about MRIs. And if you're not getting better, or if you've had multiple ankle sprains and your ankle's pretty loose, a lot of people come in, they tell me, every time I play basketball, I roll my ankle. Then we know that those ligaments on the outside are incompetent. It's like a rope that's stretched out, right? And it's not holding your ankle together anymore. That's another indication for me to get an MRI and kind of dig a little bit deeper and see if there's something that we should be doing maybe surgically to give you that stable ankle so you can get back to dunking on these dudes. Another big injury that I see are ACL injuries. First question people ask, what's the ACL, what's it do, what's its function? If we open the knee up, there's the ACL is kind of right in the front. It connects your femur to your shin bone. It's called the anterior cruciate ligament. Cruciate meaning crossing, because there's also a PCL, which is posterior cruciate ligament. So they kind of cross in the middle. They give your knee stability kind of in this direction. We've seen it all. Watching basketball, somebody comes in, lands awkwardly coming down from a rebound or a dunk, and their knee kind of buckles underneath them. Same classic story. They felt a pop. Surprisingly, a lot of people will finish the game. They'll say, yeah, I kept playing, but then my knee started to get more painful, more swollen. Those are all telltale signs of an ACL injury. That's something that you should come in, see your orthopedic doctor, because that's something that we don't want to miss. You miss an ACL injury, you keep playing, your knee buckles on you again, and you're potentially setting yourself up for worse knee injuries in the future. So that's something you should definitely see an orthopedic doctor about, because they're going to likely get x-rays and MRIs to dig a little bit deeper. The other big thing that I see are hand and wrist injuries. I'm going to kind of combine them together. The big one for basketball is when the ball gets passed to people, the ball kind of hits the tip of the finger and you can get your finger jammed. A lot of times it's just a jam, kind of swollen, bruised. People have all felt that. But there's the rare instance that you actually injure the bone or injure where the ligament attaches to the bone. So then you get this finger that's droopy, you can't straighten it. Those are injuries that you should also probably see an orthopedic doctor about, because if we wait too long on those, your body's trying to heal, and you potentially could get stuck with a finger that doesn't extend. So we put you, doesn't mean surgery, but sometimes we put you in a brace that keeps those ligaments or bones that are torn in close proximity, let it heal. Sometimes if it's a big enough injury, that's including the joint surface, we're talking about a procedure to put everything back in place so you can have good full function of that finger. The other thing too are wrist injuries, right? So you fall, land, you try to brace yourself, you can injure the ligaments that connect the small bones in your wrist. You can injure something called the TFCC. It's a little cartilage ring on the outside part of your wrist, kind of out here. Or you can break your distal radius or your wrist bone. And that's all about how you land, kind of bracing yourself. So keep in mind when you fall, try to tuck and roll, try not to put it all on your wrist. Another big one that I see a lot, and I've actually experienced myself, are calf strains. So calf muscle kind of up here, goes into the Achilles tendon, attaches down on your heel bone. There's a pretty classic story that people feel or come in describing. They say, yeah, I was running, I felt like there was a rubber band that snapped, or somebody kicked me, I looked around, there was nobody there. Usually what it is what's called the medial head of the gastroc. It's one of the muscles that make up your calf. The connection between the muscle and the tendon is sort of a weak spot, and that can tear or sprain or partially tear. Great news about that is we don't do anything about it, in the sense that we don't have to operate, or there's nothing aggressive that we have to do. Good physical therapy, period of immobilization, and all the rest, ice, compression, and elevation that you can tolerate. I'll tell you from experience, same exact story, playing basketball, thought somebody shot me with a BB gun. It was one of those snaps, and I looked around and there's nobody around me. So pretty classic. In that same vein, same storyline, something that we don't want to miss is the Achilles injury. So as that calf muscle comes down, it attaches through the Achilles on your heel bone. People feel that same kind of snap. We see it in the NBA, or if you're watching March Madness, you're almost always going to see one person kind of land or try to push off, and you can almost see that band popping. That's a situation that you might need a little bit more than just conservative care. It kind of depends on your age, your activity level. There's risks and benefits to trying to treat it non-operatively versus operatively. And there's a bunch of different techniques if you are going the operative route. But those are all things that your orthopedic surgeon can talk to you about and guide you through. But it's one of those things that you don't want to miss. You can't really function too well with a torn Achilles tendon. Can't get around very easy, as you can imagine. All right, guys, thanks again for watching. Hope you learned a few things. If there's anything that you want me to talk about or you want explained maybe in more depth, put it in the comments. Happy to talk about it. Otherwise, we'll see you on the next one.